There's many different causes for arthritis, and this is why you have to initially go to the doctor and get examined. Basically, arthritis is loss of articular cartilage, which is a substance that coats the ends of our bone and allows our joints to glide very smoothly and without much friction over one another. If you've ever prepared a chicken, you may have seen the glistening white articular cartilage on the end of the thigh bone. And that's what normal articular cartilage looks like. If you lose the articular cartilage, that is what we refer to as arthritis. And so instead of having a nice smooth surface for the bones to glide across one another, it's more like sandpaper. And there's a lot more friction. There are molecules that are released from the joint surface that cause inflammation, and you see deterioration in joint function. You can lose articular cartilage because of general wear and tear. There are some potential factors that will make you more predisposed to wear and tear. The alignment of your joints, how active you are, the kind of activities you do. If you are overweight, you're more susceptible to wear and tear type of arthritis. We know that 2.5 times your body weight goes through your leg with one step. So 10 or 15 pounds can make a big difference whether or not your knees or your feet are symptomatic. There are inflammatory conditions that cause arthritis, and these you may have heard of rheumatoid arthritis, for example. The difference here is that the lining of the joint becomes inflamed and secretes molecules that then lead to the breakdown of cartilage. Post-traumatic, if you fracture through a joint, you can develop arthritis. There are many different causes. You could have infection. There could be metabolic crystal disease like gout. But by far the most common reason that people develop arthritis is a wear and tear degenerative type of arthritis. And I think that the key thing, once you have been told that you have arthritis, is to try to figure out why you're overloading that part of your body. And once you understand why you're overloading that part of your body, then you can make some changes. For example, if you have complaints in your knee of pain, you can look at my you can look at my knee, my legs. I'm a little bit bow-legged, which predisposes me to wear and tear on the inside of my knee. If I was more knock-kneed, that predisposes to wear and tear on the outside of the knee. So there's not a lot that we can do necessarily about the alignment of your legs, short of doing surgery and what's called an osteotomy. But you can make sure that you're wearing proper footwear so that it doesn't accentuate the problem. And you can also use various braces to unload the compartment that's being overloaded. And very importantly, how your muscles are working. You want to make sure that you're not too tight and have imbalances around your knee, and that you're activating your VMO and your glutes appropriately. So following the 3 R's to come to a conclusion as to why you're overloading that part of the joint, and what are the things that you can do to unload that part of the joint by relaxing tissue, rebalancing tissue, and then activating the proper muscles.